The last time I did a recording was back in May. I'm sorry about the time lag between episode 7 and episode 8, but there's a reason for that. I didn't want to do a new podcast because I wanted to see if I could advance in my recovery enough to have really good news to report instead of a long drawn out explanation of what was happening to me along the way. I was only getting home health care for 1 day a week. I was limited in the progress that I could make in June, July, and it was a little discouraging. I could do walking, I could do standing, I could do the things that they helped me with, and they were good, but insurance would only pay for 1 day a week at the end. So I thought I've reached a plateau. It's unfortunate. I want to move faster. And so I reached out to my orthopedic surgeon and I said, if you think that I'm eligible for outpatient physical therapy, I've worked it out with my wife where I can go. So will you sign off on it? And I felt like I had reached a point in my recovery that I would benefit a lot from going to outpatient physical therapy as opposed to trying to do it on my own. I felt my legs were stronger. It had been over a year for my right leg and months for my left leg. So I wasn't having any pain in my knees. My core was really the weak point when I tried to stand and walk in the walker. And I bought a really good rollator. For those of you that may not know what that is, it's not like a walker, which is a frame with wheels on the front. It's actually got 3 wheels, one in the front, 2 in the back, and it's freewheeling with brakes on the handles. But because I'm 6'7", all the ones that I was looking at were not going to extend high enough. So I finally found one that would accommodate someone up to 7 feet tall. So I bought that. It was expensive, but it also held up to 500 pounds and it had a seat. So you could turn around and sit down in it, and it had a bag to carry things. So I thought, I'm going to reach a point where if I'm going and driving by myself and getting out and going like physical therapy or whatever, and I need to use the rollator until I'm getting better at walking and balance, then I need to migrate to that. Well, it was very difficult for me. When I tried it with home PT, I really didn't have enough room in my little house to do a lot with it. I could make a big circle through the bedrooms, but then I had to try to maneuver around things, and that was difficult. It also was so freewheeling that I didn't feel secure like I did in the walker. And the last thing is the distance between the wheels was only 24 inches, which means I had to take my big size 16 shoes and make sure that I didn't hit one of the wheels when I stepped forward. I couldn't push it out too far in front of me because it could cause me to lose my balance. So all in all, I was plateaued and discouraged, but I reached out to Spring Hill Physical Therapy, and this is the group of folks that I went to before I fell, trying to get ready for the wedding back in 2024. And as you recall, in my previous episodes, I described what a great group of folks they were, and they were helping me strengthen my legs. But there was nothing they could do about my terrible arthritic knees. That took knee replacement. I reached out to them and said, my orthopedic surgeon has given me clearance to go ahead and come back to you guys. Okay, that happened. I've been there about a month and a half, and I wanted to do this podcast to let you know where I'm at in that recovery and just how great it's been to work with that group of people that I had worked with before. So anyway, when I first showed up, they evaluated me and said that they felt I could benefit from several things. One, obviously the exercise that physical therapists could bring to the table, but also a device called a PENS, PENS system, which was a series of electrodes that stimulated the muscles using electrical activity. And so that way the muscle could be encouraged to regenerate. So I started a regimen of getting a PENS treatment at the end of each session. And during the session, I initially started on a platform where I did basic exercises, strengthening legs, excuse me, strengthening upper body, lower body, just working as much as I could from the platform. Then getting up and standing from the platform, which was difficult. And finally, I was graduated from the platform after a couple of weeks into doing exercises in my chair to warm up, and then moving to a walker. And I started doing long revolutions of the gym. So at one point I could make it around the gym with my walker, and about a week later I could make it around 2 times, and a week later I could make it around 3 times. So I was getting more confident with the walker. I was encouraged by the strengthening that the exercises were giving me, and it was proof that outpatient physical therapy, with all the devices that I have and the fact that I was working in a large gym, which allowed me to walk better, walk faster, improve quicker. So here it is, about a month and a half in, and now I've graduated to the rollator. And the rollator is a bitch. I will have to tell you that. That is not fun. It is a tile-based floor, which means the rubber wheels are going to roll very easily. There are some obstacles along the way that I have to kind of go around, the platforms, equipment, whatever. But recently I've been able to do 2 and 3 revolutions around the gym and walk what's called a rollator walk. Now with the walker, you put it forward and then walk to it. Put it forward, walk to it. That's a step walk, and it's actually called the wedding walk, because when you're walking up the aisle, you step forward and stop, you step forward and stop. And so that's not good to relearn walking. It's good to strengthen your legs and your upper body, or sorry, your core, but it does really no good in giving you the cadence that you need to walk normally, or the balance, or the ability to move in a steady walk instead of a start-stop. Well, the rollator brought me that, and they showed me how to position my feet so that I wasn't as prone to going and hitting the wheels. I was able to then get on one of the more straightaways in the gym and be able to walk a little bit faster. However, they wanted me to really focus on just putting my foot forward, doing a heel-toe walk, a normal walk, which now I've been working on and getting better. Now this week we had a bit of a change because we tried the steps. And it turns out that my knees are in pretty good shape. My quads and my calves are benefiting greatly from the PENS system. And all the exercises that I'm doing are strengthening those. But it turns out that my weakness is my hips and the upper quads. So we started working on exercises to improve those. And I was excited because I thought, well, maybe I can try the steps. Now, I had tried the steps a few weeks earlier. I couldn't even make it up on the first step. It's a wooden platform with about 5 steps up to the top with railings. I couldn't even take the first step. This time, after working several more sessions, I was able to step up on the first step with my big size 16 shoe, which made it difficult because I had to kind of turn my foot sideways. But I was able to step up with my left leg and bring the other leg up and then step back down. But when I stepped with my right leg, I couldn't do it. I was having to brace myself on the arms and then kind of jerk myself up. So my physical therapist said, well, wait a minute, this is a true indication that especially the hips, the hips on the right side are weak. Both your hips are weak. We're going to have to really strengthen those before you're able to do these steps. But the good news is you're working hard on them and you're wearing yourself out. So you're pushing yourself, but we've got to get those upper quads and everything working again, and especially your muscles that basically in your buttocks and hip, because when you stand or you walk, the message to your brain is that when you stand, you want a quick motion upward to stand. It's like a rush. It's like, okay, muscles, give me everything you got so I can stand up. It's been so long since my brain got those messages. Even when I was walking with a cane, going up steps was difficult. And therefore, it stands to reason that it's been a long time that my brain is actually given those commands to push hard, quick, go up. So a couple of days ago, I actually was able to move to a machine. And I know you've seen these in gyms that you go to. It's a machine where you hook your legs. You're in a kind of a tilted chair, and you hook your legs under some pads. The weights are in the back. They put a 20-pound weight on, and I would pull my legs up straight and then slowly back down. And I found they wanted me to do 3 sets of 10, and I did 4 sets of 20, which is probably not a smart thing, but it felt good. The next day, not so good. I was hurting. I took some Tylenol, but bottom line is I felt a tremendous burn in my quads, upper thighs, and hips, and this meant that I was working those areas really hard with that machine. So I'm hoping today, which is a Friday, that I'm able to get in that machine again and do more, because I think that's going to really strengthen my upper quads, my quads, and then with the other exercises we're doing for my core and my hips, I'm really hoping that things get better. Now, as far as balance goes, I'm doing better with balance. I stand a lot at home. One of my little challenges is when we eat on trays and watch British detective shows. And when my wife is I cook and then she gets the trays ready. And I stand in the den and kind of just balance myself with one finger on my table and stand. And my goal is I'm not going to sit down until she brings my tray. Well, sometimes that's 2 or 3 minutes, and sometimes that's 5 minutes. And it just depends on what she has to do to get everything on the tray and get it to me. So that's one thing. And the other thing, I'm standing in the kitchen more when I'm doing things instead of bringing my chair up, which I haven't done in a long time. I haven't raised the chair where I could reach things. I stand up and reach them and then work on stuff. So because I'm doing a lot of cooking, it's really helpful, working in the kitchen, doing those kinds of things. So my balance is getting better. My spatial orientation, which is to know where my feet are, is very good. Well, I don't know, very good, but good enough at this point of recovery. So that's encouraging. It's encouraging that, I'm seeing progress. And what makes me nervous now is apparently I have about 8 more sessions approved, and then I'm going to be reevaluated by Medicare. And historically from my podcast, I've been kicked out of every rehab unit in Alabama and Florida too early. And I'm fearful that this is going to happen to me again. And so they're asking me, do you have a game plan of what happens when Medicare says no more? And I haven't really thought this through yet. I just wanted to do a quick episode, a shout out to my home PT folks that worked so hard with me over the months to get me to the point where I was going to benefit the most from outpatient physical therapy, because I knew I was going to be limited in the amount of Medicare paying. So I didn't want to go in too soon and then reach a point in my recovery that I was really disappointed because, they kicked me out and I wasn't progressing as far as I would have hoped. As it turns out, I think I picked a pretty good time to get it. And now it remains to be seen how much acceleration they can do with me. And every week is tougher than the week before. In fact, every day I go, which is Monday, Wednesday, Friday, every day I go is rougher than the time before. So they're pushing me really hard. I'm pushing myself really hard, and hoping that we're kind of shooting for October timeframe. I would really like to be able to get rid of this hospital bed, be able to sleep with my wife in our bed, which would be wonderful. We've kind of been bedroom divorced here for 2 years or more, with me in the dining room in a hospital bed and her in our bed. And I'm still worried about things that happen to me during the night that may cause her to wake up, and she needs her sleep because she's back in school next week. But we do have a game plan there. If we get rid of the hospital bed, I'm sleeping in our bed, and I mess things up so she can't sleep appropriately. We have a new mattress on the bed in Faye's room, which is very comfortable, and she could move into that room if she has to and sleep there, which means we would get our dining room back. We wouldn't get necessarily all our sleeping together back, maybe the weekends or whatever. I don't know. We have to test that out. But getting our dining room back would be huge. And we really want to have that done before Thanksgiving, because we want to, have some of the family here for Thanksgiving, and we want a dining room. And, there's just medical stuff everywhere. So I've got to try to get rid of, catheter stuff and pads and wipes. And there's just so much that goes on to taking care of myself at home. And I'm hoping I'm able to consolidate some of this and reduce the amount of medical stuff I'm having to buy, because I'm having to pay out of pocket for that. I don't know if I ever mentioned that, but about $200 a month that I have to pay just to keep myself stocked with the stuff that I need to function while I'm still cathing. Which brings me to that point. I'm still cathing. It's gone from 3 times a day to 2 times a day, which is good, in the morning and at night. Now, I have to do a 3 times a day because I have to do a midday before I go to physical therapy. But it is reducing down. And I'm finding that I'm able to go, when I go, better without having to cath. But it's one of these things where I'm not going to let myself believe that I have to do this for a long period of time. I really believe that once I'm walking fairly normally, get my brain working again to communicate properly with the smooth muscle in my bladder, that I'll be able to actually just pee on my own again like normal. If that's not the case, I guess I'll cross that bridge when I come to it. I guess the good news about cathing is I know that I'm completely emptying my bladder, so that I'm not running into issues with more urinary tract infections. But now that I have a month and a half behind me in outpatient physical therapy, I felt like I had a good message to share with you guys. And, I'm basing it on my progress. And one thing I should mention, I forgot, I am able to sit in the recliner where we're sitting next to each other watching TV. So just to get out of the wheelchair and into that lounger, which is wonderful, and recline back, that's reducing the pressure on my hips. It's relaxing. I get to hold hands with my wife. Watching TV, I still have to eat in the chair from my table. So I really can't hold things in my lap yet really, really easily. So anyway, I'm going to sign off. Thank you all, and take care, and I will talk to you soon.